Hello aspirants, welcome to GDC English classes. I hope you are already busy with your pharmacist preparation regarding Telangana as well as RRB pharmacist, and 100% there is a chance of upcoming central government health scheme pharmacist also. So please put your one efforts on competitive preparation like government jobs. Definitely you will get any of like RRB or Telangana pharmacist or CGH, whatever it may be. Upcoming drug inspector also there. So put your 1 hour effort, nothing but 1 year effort. Definitely you will crack any type of exams, and definitely GDC here to help you. And this is free for all. That is TEJAS series on pharmacist MCQs and explanation. So subscribe to GDC English classes. So let's start our session on Autacoids and related drugs with MCQs and explanation. So first MCQ will be blockade of both dopamine type 2 and serotonin 5-HT2A or 2C is distinctive feature of. So the feature of one of the drug is it can block type 2 dopamine receptors as well as serotonin type 2A or 2C subtype. So drugs like pimozide, 𝙎𝙬𝙬𝙐𝙐, ketanserin, clozapine. So here these are the list of the drugs. So apart from ketanserin, all are antipsychotic drug. So 𝙎𝙬𝙬𝙐 is a first generation antipsychotic which is potent in nature, and clozapine is a second generation antipsychotics. And ketanserin is a drug for treatment of migraine. Yes, here answer will be the clozapine. So clozapine is a second generation antipsychotic, also known as atypical antipsychotic. And here clozapine, let's see the discussion. So mechanism by which clozapine exert its effect involve blockade of serotonin 2A 2C serotonin receptors and dopamine 1,2,4 receptors with the highest affinity for dopamine type 4 receptor. So there are many types of antipsychotics regarding examples. They having mostly blocks type 2 dopamine receptors, but clozapine can block type 4 dopamine receptor and also serotonin subtype 2A or 2C receptor. And the clozapine is, so here it will be wrong. Clozapine is a second generation. Clozapine will be the second generation antipsychotic, work by inhibiting dopaminergic neurotransmission. Their effectiveness is best when they block about 72% of type 2 dopamine receptors in the brain. Especially there is a excess activity, there is an increased activity of dopamine in the brain in case of psychosis. In case of psychosis, also known as schizophrenia. Next question. All second generation, wait a minute. All are second generation H2 receptor blockers, antihistamines, except, so option will be cetirizine, clemastine, fexofenadine, loratadine. So all are second generation antihistaminic drugs except cetirizine, clemastine, fexofenadine, loratadine. So loratadine derivative is the desloratadine. The answer will be the clemastine. So remaining all cetirizine, fexofenadine, loratadine are second generation. Clemastine will be the first generation. So here this is a simple classification of a antihistamines, especially H1 receptor blockers. H1 receptor blockers main use is in case of allergic reactions. So here first generation H1 receptor blocker like highly sedative. So here this highly sedative can block histamine receptor and can cause sedation by reaching blood-brain barrier, like diphenhydramine, dimenhydrinate, promethazine, hydroxyl, and moderately sedative like phenyramine, derivative chlorpheniramine. So chlorpheniramine comes under mild sedative. And cyproheptadine. Cyproheptadine is a H1 receptor blocker as well as it can block serotonin receptors also. And meclizine, cinnarizine. Next, mild sedative like chlorpheniramine, dexchlorpheniramine, triprolidine, and clemastine comes under the mild sedative category, first generation H1 receptor blocker. and there are four types of histamine receptor: H1, H2, H3, H4. All histamine receptors are belongs to G protein coupled receptors. Next, second generation antihistamines like fexofenadine, loratadine, desloratadine, cetirizine, levocetirizine, azilastine, mesolastin, avastin, ropatadine. All these are second generation H1 receptor blocker with less sedation property. With less sedation. So here the prodrug of cetirizine is. So which of the following is known as prodrug of the cetirizine? So regarding options are fexofenadine, terfenadine, hydroxyzine, azilastine. So the prodrug of cetirizine is which of the following? Yes, answer will be the hydroxyzine, cetirizine, hydroxyzine. So cetirizine is an active metabolite of first generation antihistaminic drug hydroxyzine. It has marked affinity for peripheral H1 receptors, penetrates the brain poorly, but mild sedation subject to somnolence is experienced by many recipients. So simply, yes, wait a minute. So the explanation part is here. So cetirizine is an active metabolite of first generation antihistamine hydroxyzine, and wait a minute, this have marked affinity for H1 receptors, penetrates the brain poorly, but have mild sedation as well as subject to somnolence, produces sleep, and it is not metabolized, does not prolong cardiac action potential or produce arrhythmias when given with erythromycin or ketoconazole. So cetirizine is an active metabolite of first generation, that is hydroxyzine. Next, chemically histamine is named as. What is the chemical name of histamine? How histamine is chemically the name? Beta imidazole methylamine, beta imidazolide, beta imidazol sorry imidazolidinyl, imidazolidinyl ethylamine, beta imidazolyl ethylamine, n-methylhistamine, n-methylhistamine. So amine will be common because that is histamine, and beta position is also common, beta position also common. Okay, yes, let's see the what is the answer. That is beta imidazolyl ethylamine, beta imidazolyl ethylamine. So that is the chemical name of the histamine, beta imidazolyl ethylamine. Histamine is present mostly within the storage granules of mast cells. In mast cells, histamine is positively charged, held by an acidic protein, and heparin negatively charged within intracellular granules. Within intracellular granules. Next. So name the enzyme 1, 2, 3 from the given figure during synthesis and degradation of histamine. So histidine converts to histamine, and histamine converts to n-methylhistamine, and histamine may also converts to imidazole acetic acid. Imidazole acetic acid. So histidine is nothing but is the amino acid. Histidine is a amino acid contain imidazole group, histidine. That histidine first undergoes decarboxylation in branch of decarboxylase enzyme. In branch of decarboxylase enzyme. So decarboxylase enzyme present here. Option B, option C. Next, this histamine undergoes conversion as a n-methylhistamine. So addition of a methyl group. So n-methyl transferase. So addition of methyl group by the methyl transferases, and here methyl group transfer to the n group, n-methyl transferase. and histamine converts to imidazole acetic acid. Amines converts to acid. Histamine to acetic acid in presence of diamine oxidase. So histidine undergoes decarboxylation, gives histamine in presence of decarboxylase enzyme, and histamine to N-methyl histamine in presence of N-methyl transferase, that is addition of methyl groups with the help of transferases, and diamine oxidase converts histamine to imidazole acetic acid. Yes, the answer will be the C. And let's see the clear explanation for getting more clarity. That is, histidine is an amino acid. In presence of histidine decarboxylase gives histamine. Histamine is a beta imidazolyl ethylamine. Beta imidazolyl ethylamine. This histamine in presence of N-methyl transferase gives N-methyl histamine. Addition of methyl group on N position, and the same histamine beta imidazolyl ethylamine converts to imidazole acetic acid in presence of diamine oxidase. In presence of diamine oxidase. Yes, I hope you already know about the GDC English classes. So GDC specially started English classes in the English language, especially for the South India pharmacy students from Telangana, Andhra, Karnataka, Tamil Nadu as well as Kerala. So already GDC English classes started pharmacist coaching for all types of pharmacists, because all pharmacists, all types of pharmacists like ESIC, RRB, including different state of pharmacist also. Similarly, most of the 90% will be syllabus will be the same. That's why we started class mutually. So 100% our classes, the features like 200 plus live classes and pre-recorded video lectures you will get, and online test series, previous year MCQs with solved question papers, and e-notes you will get in our app. And the 2,995 is, sorry, 2,999 price is without materials, and with materials the price is 3,999, and it is validity of 5 to 6 months. 5 to 6 months. Okay. So the coaching is very very important, because the competition is very huge and you are preparing for to crack the competitive exams. So go for the option of coaching, definitely it will help you. And I hope you already know about the GDC quality as well as strength. So we will provide excellent classes as well as materials also, theory plus objective. Which histaminic receptor also known as autoreceptor? Which histaminic receptor known as autoreceptor? What is autoreceptor? Also known as presynaptic receptor. Autoreceptors are presynaptic receptors, inhibit the release of their own neurotransmitter. They present in the presynapse. Autoreceptors present in the presynapse. So here, what is the answer? H1, H2, H3, H4. Yes, definitely the answer will be the H3. Serotonin type 3, sorry, histamine type 3 receptors are autoreceptors, and all histamine receptors are belongs to G protein couple receptors. So let's see. So histamine type 3 receptors are presynaptic autoreceptor which control histamine release from the neurons in the brain. So H3 receptor is a presynaptic autoreceptor. The nature of autoreceptor inhibit the release of neurotransmitters. That's why control histamine release from the neurons in brain. Next, H3 receptors work by restricting calcium influx, decreasing influx of calcium into brain cells, and potassium channel activation. Activation of potassium channels decrease the cyclic AMP. So decrease cyclic adenosine monophosphate, the secondary messenger which involves in stimulation. But autoreceptors nothing but inhibit the release of their own neurotransmitter. The example from autoreceptor from histamine receptor H3, type 3 histamine. Okay, so further continuation. Fexofenadine is metabolic product of. Fexofenadine is a metabolic product of. So options, the question is fexofenadine is a metabolic product of loratadine, astemizole, cetirizine, terfenadine. So fexofenadine is a toxic metabolite of terfenadine. So these are like simple questions. So let's see the explanation. So fexofenadine is an active metabolite of terfenadine. It is the first non-sedating second generation antihistamine that was withdrawn because of several deaths due to polymorphic ventricular tachycardia torsade depointase. What is torsade depointase? Because of prolongation of Q2 interval, because of prolongation of QT interval in ECG, there is a ventricular tachyarrhythmias. So means the heartbeat is more than 100. Next, H1 blocker. H1 blocker with the least and most sedative effect. H1 blocker with least and most sedative effect. So which H1 receptor blocker having the least sedative effect and which one is having most sedative effect. So for this so which are the respectively? So which one having least sedation and which one having more sedation? So here the drugs, especially the first generation H1 receptor blocker, can cause sedation. In that first generation H1 receptor blockers also highly sedative, medium sedative, mild sedative. So the option chlorpheniramine, terfenadine, promethazine, phenyramine, terfenadine, diphenhydramine, and diphenhydramine as well as phenyramine. So the answer will be the C. So terfenadine is having least sedation property and diphenhydramine having high potential of the sedative property. Diphenhydramine is a first generation H1 receptor blocker with high sedation and terfenadine is also having least sedation. So let's see the discussion. So terfenadine is a second generation antihistamine having least sedation, whereas diphenhydramine has most sedation action among H1 receptor blocker. What is the advantage of second generation antihistamines over first generation? So especially the second generation antihistamines having high selective blocking property of serotonin 1 receptor, they does not having any anticholinergic activities. Especially diphenhydramine is a first generation H1 receptor blocker, can also block the cholinergic receptors and especially the advantage with the second generation antihistamines, there is no CNS depressant effect. In case of first generation H1 receptor blocker, there is a CNS depression will be there and additional anti-allergic mechanism apart from histamine blocking. So second generation not only block H1 receptors and also having anti-allergic action. So no impairment of psychomotor performance like does not disturbance driving skills. Especially first generation H1 receptor blocker, if the drugs taken, the person should not go for any motor activities like driving. No subject to effect, no sleepiness. Do not potentiate alcohol or benzodiazepines action. So these are the list of advantages of second generation H1 receptor blockers over first generation. Next, which are the following? Right, a minute. So, which of the following is a selective H1 receptor agonist? Which of the following is a selective H1 receptor agonist? 4-methylhistamine, impromidine, 2-thiazolyl-ethylamine, chlorpheniramine. So chlorpheniramine is a H1 receptor blocker and definitely the answer will be the 2-thiazolyl-ethylamine. 2-thiazolyl-ethylamine is H1 receptor selective agonist. So these are the chemical compounds. These are not having any clinical application. Yes, let's see here. Histaminergic agonist. The drugs acting as a agonist on histamine receptor. So this histamine receptor agonist does not having clinical application, but histamine receptor blockers are having clinical application, especially H1 receptor blocker allergic reactions treatment and H2 receptor blockers for treatment of peptic ulcer like ranitidine. So non-selective agonist, histamine, beta histine. Histamine, beta histine both are non-selective as a agonist on histamine 1, histamine 2, histamine 3 receptor. And selective H1 agonist like 2-methylhistamine, 2-pyridyl ethylamine, 2-thiazolyl ethylamine. and selective H2 receptor blockers, dimaprid, impromidine, and selective H3 receptor agonist like 𝙈-methyl-histamine imitate. So 𝙈-methyl-histamine imitate, selective H3 receptor agonist, selective H2 receptor, dimaprid, impromidine, 2-methyl-histamine, 2-pyridyl-ethylamine, 2-thiazolil-ethylamine are selective H1 receptor agonist. Next, which of the following is amine derived autacoid? Which of the following is a amine derived autacoid? Histamine, prostaglandin, platelet activating factor, leukotriene. Yes, the answer is simply amine, histamine, and prostaglandins, platelet activating factor, leukotrienes are lipid derived. Answer is a histamine. So let's see a brief introduction on autacoids with explanation. Substance formed in autacoids are substance formed in various tissue, act locally at the site of synthesis. Autacoids nothing but local hormone. They have brief action and destroyed locally. So shows action very shortly and immediately degrade, metabolized, and hence they showing action. So these are the autacoids are local hormone present in every tissue in the body. They acts locally. For example, autacoids of heart shows action in heart. So every organ in the body produces its own autacoids. That's why they are known as local hormones. For example, autacoids of heart shows action in heart. Autacoids of lungs shows action in lungs. That's why they are known as local hormones. Local hormones. And hence they are known as local hormones. The word autacoid derived from auto self acos remedy, self remedy. So autacoids of heart involves in the healing of heart, self remedy. So regarding classification, amine autacoids like histamine as well as 5-hydroxytryptamine serotonin, histamine, 5-hydroxytryptamine serotonin, and lipid derived autacoids like prostaglandin, leukotriene, platelet activating factor, and peptide derived autacoids like plasma kinin, bradykinin, 𝘾𝙀𝙍 as well as angiotensin. Next, which of the following is not an 𝙂𝙀𝙎𝘾𝙀? Which of the following is not an 𝙂𝙀𝙎𝙀? Interleukin, leukotriene, thromboxane, prostaglandin. So prostaglandin, thromboxane, leukotrienes are 𝙂𝙀𝙎𝑖des, but interleukin is not an 𝙂𝙀𝙎𝙀. 𝙂𝙀𝙎𝙀 nothing but a group of fatty acid. Interleukin will be the answer. So let's see what are 𝙂𝙀𝙎𝑖des. So 𝙂𝙀𝙎𝑖des are class of molecules derived from 20 carbon. 𝙂𝙀 is Greek for 20, 𝙂𝙀. So these are polyunsaturated fatty acid. Polyunsaturated fatty acid 𝙂𝙀𝙎 containing 20 carbon. Most frequently, the common example is arachidonic acid. The 𝙂𝙀𝙎ides include prostaglandins, thromboxane, leukotriene, as well as lipoxins. Lipoxins, leukotrienes, thromboxane, prostaglandins collectively comes under 𝙂𝙀𝙎ides. 𝙂𝙀𝙎ides are 20 carbon compound. The common example is arachidonic acid, and they are polyunsaturated fatty acids. They are polyunsaturated fatty acids. Next, select the H1 antihistaminic which is used topically in the nose for allergic rhinitis. Select the H1 antihistaminic which is used topically in the nose for allergic rhinitis. Means running nose. Increased cold may leads to the increasing secretion from nose. Next example, loratadine, cetirizine, fexofenadine, 𝘎𝑒lastin. So the answer will be the 𝘎𝑒lastin. So 𝘎𝑒lastin is a selective H1 receptor blocker topically applied on the nose for allergic rhinitis. For allergic rhinitis. So 𝘎𝑒lastin is a selective H1 receptor blocker applied topically on the nose for treatment of allergic rhinitis. So let's see the discussion. 𝘎𝑒lastin a new H1 receptor blocker with good topical activity. In addition, inhibit histamine release, inflammatory reaction triggered by leukotrienes as well as platelet activating factor. It is given by nasal spray for seasonal perennial allergic rhinitis. Provides quickly symptomatic relief about 12 hours within 12 hours. And after intranasal application, it has been shown down regulate intracellular adhesion molecule 𝘂𝐾𝙉1 expression on nasal mucosa. So simply when it is applied intranasally, it is down regulating the intracellular adhesion molecule 1 and decreasing the inflammation as well as release of histamine. Next. Yes, next, fill the numbers from the given option. So, fill the numbers from the given action. So, the same pattern of question you already observed in the previous slide. I hope we can get the answer easily. So, fill the numbers from the given option. Tryptophan converts to 5-hydroxytryptophan, but before question on the histamine, now it is question on the serotonin. So that is there is a instead of tryptophan there is a histidine. Okay, here tryptophan conversion to 5-hydroxytryptophan and 5-hydroxytryptophan to 5-hydroxytryptamine. So tryptophan converts to 5-hydroxytryptamine. There is addition of hydroxy OH group with help of hydroxylase enzyme, and this 5-hydroxytryptophan converts to 5-hydroxytryptamine. So tryptamine. So hydroxylase is the enzyme. So hydroxylase is the enzyme present in option A, option C, and here then that 5-hydroxytryptophan converts to so 5-hydroxytryptophan converts to tryptamine. So definitely the answer will be the option C, because tryptophan 5-hydroxytryptophan is like amino acid that converts to 5-hydroxytryptamine with the help of removal of carboxyl group. So hydroxylase, tryptophan hydroxylase involves in conversion of tryptophan to 5-hydroxytryptophan and 5-hydroxytryptophan to 5-hydroxytryptamine with help of decarboxylase enzyme by the process of decarboxylation. So tryptophan in presence of hydroxylase converts to 5-hydroxytryptophan. 5-hydroxytryptophan in presence of decarboxylase 5-hydroxytryptamine. So the next MCQ will be the following action of 5-hydroxytryptamine is mediated by serotonin type 3 receptor. Which of the following one of the action can mediate by the serotonin type 3 receptor? Vasoconstriction, bradycardia, EDRF, endothelium derived releasing factor, endothelium derived relaxing factor, and platelet aggregation. So which of the following action of serotonin is mediated by serotonin type 3 receptor? So answer is bradycardia, decreasing heart rate. So see the explanation. So serotonin type 1 receptor involves in decreasing cyclic AMP levels, that is cyclic adenosine monophosphate, that is presynaptic. So that decrease the histamine as well as serotonin release. And serotonin type 2 receptors. Serotonin type 2 receptors also presynaptic. And serotonin type 3 receptors effect on heart decreases heart rate and also low BP. And serotonin type 4 receptors on the GIT causes contraction, increases contraction of gastrointestinal smooth muscle. Next, the most important receptor involved in cytotoxic drug induced vomiting is serotonin type 2 receptor, serotonin type 3, dopamine type 2, opioid mu receptor. Definitely if you observe, serotonin type 3 receptor blockers like ondansetron, granisetrons are used as a potential antiemetics in the treatment of cancer chemotherapy. So anti-cancer drugs having high chemical potential, they can produce vomiting. So that vomiting can controlled by serotonin type 3 receptor blockers. Serotonin type 3 receptor blocker. So serotonin type 3 receptor is the most important receptor involved in cytotoxic drug induced vomiting. Cytotoxic drug induced vomiting. Yes, let's see regarding serotonin receptor. The location is CTZ, chemoreceptor trigger zone. The zone can trigger by chemical agents. On stimulation of this CTZ causes vomiting. Serotonin type 3 receptors present in the GIT gut and in vomiting center participate in vomiting, present in the gut as well as CTZ in the brain. Especially evoked by, stimulated by cytotoxic drugs like anti-cancer drugs as well as cancer radiotherapy, mediated by release of serotonin and its action on serotonin 3 receptors in gut. When anti-cancer drugs or any radiation therapy of cancer is performing, that may stimulate the serotonin 3 receptors in brain as well as GIT and produce vomiting. That's why selective serotonin type 3 receptor blockers like cetrons, ondansetron, granisetron, a potential antiemetics by blocking serotonin type 3 receptors in CTZ as well as GIT. So the following is a selective serotonin type 4 receptor agonist. The following is the selective serotonin type 4 receptor agonist like buspirone, sumatriptan, cisapride, clozapine is selective type 4 serotonin 4 receptor agonist. So buspirone is a partial agonist on serotonin type 1A. Sumatriptan also acts on the serotonin. So clozapine is the antipsychotic. So definitely answer will be the option C, that is cisapride. So cisapride will be the selective serotonin receptor 4 agonist. So let's see here, the discussion is simple. So agonist on serotonin 1 subtype 1A buspirone is a partial agonist for treatment of anxiety, anxiolytic or anti-anxiety drug, and as a agonist on serotonin 1B or 1D receptor subtypes, sumatriptan for treatment of migraine. All triptans are agonist at serotonin 1B or 1D receptor for treatment of migraine. Next, 2-methyl-phyrhydroxytryptamine is agonist on serotonin 3 receptor. Metoclopramide, cisapride, renzapride, all are serotonin receptor 4 agonist. And antagonist, ketanserin, a antihypertensive drug, blocks serotonin type 2 receptor. Cyproheptadine, a antihistamine, also blocks serotonin type 2 receptor, and cyproheptadine is drug of choice for serotonin syndrome, in which case excess serotonin levels in the brain. And serotonin type 2A 2C antagonist, clozapine, methylsulfate for treatment of migraine. And selective serotonin type 3 receptor antagonist like ondansetron, granisetron, a choice for chemotherapy induced vomiting. So vomiting because of anti-cancer drugs, chemotherapy drugs. So selective serotonin receptor 3 blockers, cetron, ondansetron, granisetron, dolasetron, all are potential antiemetic drugs, helps in treatment of vomiting by anti-cancer drugs, chemotherapeutic drugs. Next, the following drug. The following is a selective serotonin type 1D receptor agonist. So buspirone is a 5HT1A receptor partial agonist. Ondansetron, selective. Ondansetron is selective serotonin type 3 receptor blocker. If you observe here clearly, what is the question here? Serotonin type 1D agonist. Serotonin type 1D agonist. So if you observe, the answer will be the sumatriptan. So sumatriptan, triptans are selective serotonin 1D receptor agonist for treatment of migraine. Okay. So continuation of this MCQ explanation regarding serotonin 1D subtype receptor. So here The serotonin type 1D, the subtype of serotonin receptor shown to regulate dopamine tone or dopamine actions in the substantia nigra as well as basal ganglia of central nervous system. Basal ganglia of central nervous system. And next, anti-migraine drug sumatriptan is selective serotonin 1D or 1B subtype serotonin receptor agonist. Like all triptans are agonist at serotonin 1B or 1D receptors, act as a anti-migraine drugs, helps in the treatment of migraine. And other functions of this serotonin type 1D receptor: inhibition of serotonin release from forebrain serotonergic neurons, and noradrenaline release from the sympathetic nerve endings, and inflammatory neuropeptides from nerve endings in the cranial blood vessel. Inhibit the release of serotonin as well as with help of interneurons, connection between different neurons. With help of interneurons, decrease the noradrenaline release from the sympathetic nerve endings as well as inflammatory neuropeptides like substance P in the cranial blood vessel. Next, which of the following serotonergic receptor is autoreceptor? So, which of the following serotonergic receptors will be autoreceptor? So, serotonin type 1A, serotonin type 4, serotonin 2A, serotonin 3. So, as you know already, serotonin type 4 is majorly present on the, yes, in CNS also, but it mainly works in GAT, increased gastric smooth muscle contraction. And serotonin type 3 mainly produces vomiting. Serotonin type 1A receptor mainly target for anxiety. Okay, and here the answer will be the serotonin 1A. Serotonin 1A. So there are again in serotonin 1. So there are total 7 types of serotonin receptors are there. Among that 7 types of serotonin receptors, serotonin type 3, serotonin subtype 3 is ion channel. Remaining serotonin 1, 2, 4, 5, 6, 7 are G protein couple receptor. Except serotonin 3, all serotonin receptors are G protein couple. But serotonin type 3 is ion channel receptor. So, regarding serotonin 1 receptor is known as autoreceptor. What is autoreceptor? They are also known as presynaptic receptor. Inhibit the release of their own neurotransmitter. Works as a negative feedback mechanism. So, there are 6 subtypes of serotonin receptors like serotonin 1A, 1B, 1D, 1E, 1F, 1P. And all subtypes of serotonin receptors are belongs to G protein couple receptor in the inhibitory nature. GS means stimulatory, GIR means inhibitory. That is, inhibit the inhibit the adenyl cyclase function. If adenyl cyclase function inhibited, decreased cyclic AMP levels, cyclic adenosine monophosphate. The receptors function primarily as autoreceptors in brain, inhibit the firing of serotonin neurons or release of serotonin from the nerve endings. So these receptors function primarily as autoreceptors in brain, inhibit the firing of serotonin neurons or release of serotonin from the nerve endings. Next, ketone, serine, granisetron respectively are. So for example, yes, simply the granisetron. So always observe the MCQs clearly. First, read the MCQ 1 or 2 times, 2 to 3 times. So ketone, serine, granisetron. For example, if I am the student, I have clarity on the setron like granisetron. All setrons are selective serotonin type 3 receptor blockers. And in the previous slides also we discussed selective serotonin type 3 receptor blockers helps in the treatment of vomiting, because the serotonin type 3 receptor located in the CTZ, that is brain chemoreceptor trigger zone. If this serotonin type 3 receptor stimulated, vomiting will produce. But all setrons like granisetron, dolasetron, ondansetron, they selectively block serotonin type 3 receptor, helps in treatment of vomiting. Okay. So, yes, granisetron is a selective serotonin type 3 receptor antagonist. So, serotonin type 3 receptor antagonist is only in option B. So, definitely, blindly we can go for, yes, ketanseron is a serotonin type 2 receptor antagonist and granisetron is a serotonin type 3 receptor antagonist. Yes, answer will be the B. Ketone serin. Ketone. So tan. So ANT. Tan is an antagonist. Ketone serin is an antagonist of serotonin type 2 receptor, and ondansetron, simply granisetron, is a serotonin type 3 receptor blocker used as a anti-emetic. So let's see the discussion for more clarity. So non-selective antagonist, partial agonist or antagonist like ergotamine, lysergic acid diethylamide, 2-bromo-LSD, methotrexate, cyproheptadine, cinnarizine, and serotonin 2 receptor antagonist like ketanserin, ritonserin, clozapine, risperidone, and serotonin 3 receptor antagonist all cetrons, ondansetron, granisetron, tropisetron, palanositron, ramosetron. All cetrons are selective serotonin type 3 receptor antagonist. Helps in treatment of vomiting, severe vomiting caused by drugs like anti-cancer drugs. Next, drug of choice for acute migraine. So, drug of choice for acute migraine. So, migraine generally treated by using drugs like sumatriptan, but here options: methotrexate, sumatriptan, ergotamine, propranolol. So, what is the drug of choice for treatment of acute migraine? Because sumatriptan is a serotonin receptors agonist, helps in the treatment of migraine. Helps in the treatment of migraine. So, let's see here. The acute treatment of migraine attacks like NSAIDs as well as triptans are useful. So non-steroidal anti-inflammatory drugs are also useful. Triptans like sumatriptan they are agonist at serotonin 1B or 1D receptor agonist. So sumatriptan through subcutaneous route, drug of choice for acute attack of migraine. It is a selective agonist of serotonin type 1B or 1D receptors. So triptans, selective 1B or 1D receptor agonist for treatment of migraine. Next, select the ergot compound which is primarily for dementia purpose, nothing but treatment of Alzheimer's. So, select the ergot compound which is primarily used for the dementia. So, ergot is a natural alkaloid. So, yes, bromocriptine, a drug for treatment of Parkinsonism, ergotamine, 𝘂𝙬𝘾𝙀𝙍, methotrexate. So, which of the following ergot derivative is primarily for treatment of dementia to prevent loss of memory? Yes, the answer is 𝘂𝙬𝘾𝙀𝙍. 𝘂𝙬𝘾𝙀𝙍 is the ergot compound primarily for treatment of controlled dementia to control loss of memory. So, let's see the discussion for to get clear clarity. Dihydroergotoxin, also known as 𝘂𝙬𝘾𝙀𝙍, dihydroergotoxin, a hydrogenated mixture of ergotoxin group of alkaloids, more potent alpha blocker and weak vasoconstrictors. So potently blocks alpha receptors and have weak vasoconstriction property. In the brain, variety of partial agonistic, antagonistic action on serotonin receptors. So dihydroergotoxin has been advocated for treatment of dementia. So dihydroergotoxin nothing but 𝘂𝙬𝘾𝙀𝙍. Next, which of the following is a plasma protein derived chemical mediator of inflammation? Which of the following is a plasma protein derived chemical mediator of inflammation? Like which of the following is a plasma protein derived chemical mediator of inflammation? Serotonin, it acts as a neurotransmitter. Cytokine, globulin, as well as bradykinin. So cytokines are generally involved in the inflammation, but plasma protein derived chemical mediator of inflammation, definitely. So plasma protein derived means globulins. So globulin nothing but one of the plasma protein, but bradykinin is a peptide in nature that involves in inflammation. So plasma protein derived chemical mediator of inflammation is bradykinin. So bradykinin causes vasodilation as well as inflammation. Yes, the same discussion we already gone through the Autacoids. So what are Autacoids? What is the classification of Autacoids? So bradykinin, a plasma protein derived Autacoid, causes vasodilation as well as inflammation also. Next, wait a minute. So identify the anti-gout drug which is neither analgesic nor anti-inflammatory but suppress gout by inflammation. Suppress gout by inflammation. So identify the anti-gout drug which is neither analgesic, not pain relieving drug, not an anti-inflammatory but suppress gouty inflammation. Definitely the answer will be the colchicine. Definitely answer will be the colchicine. So identify the anti-gout drug which is not an analgesic, does not relieve the pain, does not control inflammation, but control gout. What is gout? Excess accumulation of uric acid crystals in the blood leads to accumulation in joints that develops joint pain, joint swelling, joint redness, and damage the joint, damage the architecture of joint. So answer is the colchicine. So colchicine is also natural alkaloid from the colchicum autumnale, belong to the family Liliaceae. So colchicine an alkaloid from the colchicum autumnale, and it is using in the gout since 1763. It is neither analgesic nor anti-inflammatory but specifically suppress gouty inflammation. So gout, excess uric acid accumulates in the joints, that uric acid crystals damage the joints, develop inflammation. That inflammation can decrease by colchicine because colchicine decrease the movement of inflammatory mediators towards joints. It does not inhibit synthesis or promote the expression of uric acid. So calcium does not inhibit synthesis of uric acid. It does not excrete uric acid. It simply suppress gout inflammation. So in the acute gout, drugs like NSAIDs, colchicine, corticosteroids useful. In chronic gout, 𝘂𝙎𝙎𝘎𝘶, drugs like probenecid, sulfenpyrazine, 𝘂𝙎𝙎𝙎𝘴 increase the secretion of uric acid in the urine, eliminate the uric acid. And uric acid synthesis inhibitors, 𝘿𝙂𝑃urinol, 𝘂𝙂𝑃stat. 𝘂𝙂𝑃stat, 𝘿𝙂𝑃urinol inhibit the synthesis of uric acid. Next, which drug is not included in DMARD? Which are the following drug not included in DMARD? What is DMARD? Disease modifying anti-rheumatoid arthritis drugs. Disease modifying anti-rheumatoid arthritis drugs. So drugs like chloroquine, vincristine, azathioprine, leflunomide. So here the list of drug is 100% vincristine. So chloroquine included in the DMARD, azathioprine, leflunomide. And here anti-rheumatoid arthritis drugs. So as you know, rheumatoid arthritis is a autoimmune disease. Our own immune system damages the joints and develops rheumatoid arthritis. And rheumatoid arthritis is characterized by presence of rheumatoid arthritis factor antibody, RA antibody, anti-rheumatoid factor. So in rheumatoid arthritis treatment, disease modifying anti-rheumatoid arthritis drugs. In case of non-biologicals, immunosuppressants like methotrexate, azathioprine, cyclosporine. Immunosuppressant because rheumatoid arthritis is an autoimmune disease. We have to suppress excess active immune system. And sulfasalazine. Sulfasalazine can have antibacterial activity as well as anti-inflammatory activity. Sulfasalazine is a prodrug. And chloroquine, hydroxychloroquine, leflunomide, a immunomodulator, modulate the immune system. If immune system is overactive, control the activity. If immune system is less active, increase the activity, modulate the immune system. And biological, these substances prepared based on molecules present in the body. For example, TNF alpha inhibitor, tissue necrosis factor alpha inhibitor, like etanercept, infliximab, adalimumab, interleukin 1 antagonist. So these are the mediators involved in inflammation and increase the severity of joint damage. So anakinra, A interleukin 1 inhibitor, anakinra, interleukin 1 antagonist. And the supportive agents, like prednisolone and other glucocorticoids having immunosuppressant anti-inflammatory activity, helps in the treatment of rheumatoid arthritis. Next, wait a minute. So the first choice of DMARD for moderate to severe rheumatoid arthritis is, so what is the first choice of drug in treatment of rheumatoid arthritis in case of medium to severe case? So hydroxychloroquine, methotrexate, leflunomide, gold salts. Gold salts also used in treatment of rheumatoid arthritis. Yes, the answer is the methotrexate. Methotrexate is an excellent compound. It having immunosuppressant action. It having anti-inflammatory action. Because of excellent efficacy and potency, it is a preferred drug in treatment of rheumatoid arthritis compared to remaining drugs. So let's see the discussion. So methotrexate is also an anti-cancer drug. So methotrexate is the disease-modified anti-rheumatoid arthritis drug, a first choice and standard treatment of most patients, including juvenile rheumatoid arthritis. Juvenile means early age. Juvenile means early age. So the response of methotrexate is predictable, sustained over long term, sustained, maintained. Combination regimen of 2 or 3 DMARD mostly include methotrexate. So, especially the combination for treatment of rheumatoid arthritis, it should include methotrexate because it having anti-inflammatory as well as immunosuppressant activity. The beneficial effects in rheumatoid arthritis are probably because of inhibition of cytokine production, decrease the inflammation, chemotaxis, movement of chemical substance towards the inflammation, and cell-mediated immune reaction. Especially our autoimmune reactions are because of increased T cell production. That is cell-mediated immunity. So especially methotrexate decrease cell-mediated immunity, decrease T lymphocytes action, decrease the inflammation. Yes, I hope you already awareness the GDC providing along with the live classes and MCQ series and e-notes and different features. Along with that, yes, you can get these important books, GDC Fingertips theory book and GDC Fingertips objective book. By these two books, you can easily crack the pharmacist examination. And definitely, if you are join our live classes, there is a 100% assured you can crack the any exam related to pharma competitive exams like drug inspector, all types of pharmacist exams. Okay. So regarding our coaching details and our course details, you can call me on 799-531-8103. I am the coordinator of GDC English classes South region. Okay. So definitely the competition is very higher. So prefer the coaching. Definitely it make easy to crack your goal. And 100% you know about GDC, the quality and content as well as strength. So at the reasonable prices, we will give all features along with our hard copy materials. Okay, next. Wait a minute. So, flush, flare, wheel associate with injection of 𝘿𝙄𝙎𝙎𝙬, that is calcium, vitamin D preparation. Digital is a drug for congestive heart failure treatment. Atropine, a parasympatholytic natural alkaloid. Histamine produce allergic reaction. The signs will be the SIGN. Signs will be flush, flare, wheel. Definitely the answer will be the histamine. Simple logic. So just see the explanation of this MCQ. The histamine dilates small blood vessels like capillaries, H1 early and H2 delayed through H1 receptor immediate vasodilation, but H2 receptors produce little bit late effect. So, increase capillary permeability through separation of endothelial cells, exudation of plasma, exudation coming out. And when this histamine inject transdermally, it causes triple response, red spot vasodilation, wheal exudation of fluid. So surrounding that red mark, there is a fluid accumulation, and the flare spread redness. So the redness will be spreads. So red spot, vasodilation, wheal exudation of fluid, fluid will come outside, and the flare, the redness will be spread. That is these are the three signs, triple response when histamine injected transdermally. Next, meloxicam belongs to which class of non-steroidal anti-inflammatory drugs? Meloxicam, preferential COX-2, selective COX-1, preferential COX-1, selective COX-2. So meloxicam is a preferential COX-2 inhibitor. Meloxicam, preferential COX-2 inhibitor. So this is a detailed classification. Simply our MCQ is the meloxicam is a preferential COX-2. It having affinity for COX-1 but more affinity towards the COX-2. And selective COX-2 inhibitors, you will get here celecoxib, atoricoxib, paroxib. All coxibs are selective COX-2 enzyme inhibitors, does not having side effect of peptic ulcer. Next. So, wait a minute. Which of the following drug causes torsades de pointis? So, torsade de pointis is nothing but a type of ventricular tachyarrhythmias because of prolongation of QT interval in ECG. So, which of the following drug may produce torsade de pointis? Aspirin is NSAID, irreversibly inhibit COX-1, COX-2 enzymes. Naproxen, cyproheptadine, terfenadine. So terfenadine is a H1 receptor blocker, can cause torsade de pointis. So here the list of the drugs which can cause torsade de pointis. So what is torsade de pointis simply? So torsade de pointis is drug that prolong QT interval have potential to precipitate torsade de pointis, ventricular tachyarrhythmias. Drugs like antiarrhythmics, antimicrobials, antihistamines like terfenadine, estomazole, avastin, antidepressants, amitriptyline, antipsychotics, thiionidazole, risperidone, prokinetics, cisapride. Prokinetics, cisapride. Next, clinically used uric. What is the meaning of uric? Increase the excretion of uric acid through the urine. Increase the secretion of uric acid into the urine. Clinically used uric, diazepam, a benzodiazepine, sedative hypnotic, sulfenpyrazone, phenylbutazone, NSAID, phenytoin, anti-epileptic drugs. So, sulfenpyrazone, probenecid are the two category of drugs known as uric. The answer is the B, sulfenpyrazine. Again, the classification here, uric agents, both probenecid, sulfenpyrazone increase the secretion of uric acid through urine and helps in treatment of gout. Next, ibuprofen action. So ibuprofen is a NSAID, non-steroidal anti-inflammatory drugs. Ibuprofen is a NSAID, it is a non-steroidal anti-inflammatory drug. Axon, lipoxygenase pathway, cyclooxygenase pathway, kinin system, serotonin system. So ibuprofen acts on cyclooxygenase pathway. The pathway involves in production of prostaglandins through COX-1, COX-2 enzyme. So let's see here. Ibuprofen is a medication in the NSAID category, non-steroidal anti-inflammatory drugs, acts by inhibit COX enzyme, rated as safest traditional NSAID. Ibuprofen is rated as safest traditional NSAID. Okay. So let's see the flow chart. You will get more clarity. Wait a minute. Wait a minute. Please wait a minute. Okay. Yes, I'm ready to discuss. And here simply, for example, first any cell membrane is damaged. There is a that cell membrane releases phospholipids. In presence of phospholipase A2 converts to arachidonic acid. This arachidonic acid with help of COX2, COX1 produce prostaglandin G2. This prostaglandin G2 further produces prostaglandin H2 that produce prostaglandins, prostacyclin, thromboxane A2. These are the different mediators. So this lipoxygenase pathway you can clearly discuss in the theory classes. So if you want join theory classes, definitely you can contact me on the following number. Okay, so you can call me on this given number 7995318103. Yes, already the classes are started. So up to January you will get live classes regarding pharmacist coaching and e-notes available in our GDC classes app. Capital GDC, GPAT Discussion Center, GDC classes. Download from the Play Store. And even so, in this coaching you will get live classes, pre-recorded lectures, e-notes, MCQ series with explanation, and TEJAS series you will get in our YouTube. GDC English classes, capital GDC English classes. So subscribe to GDC English classes. For any details to join in our coaching, you can call on this number 7995318103. My name is Ashok Kumar and I am the coordinator of GDC South English classes. And you will get classes along with hard copies materials also. And definitely the GDC help you to crack your goals, to crack your competitive examinations. Okay, thank you. Subscribe to GDC English classes, share with your friends, and we are providing coaching for GPAT, NIPER, DA as well as Pharmacist in English language also, especially for South Indian region students. Thank you.